Hi everybody, my name is Destiny Verdusco and my presentation is going to be on Kuru disease. Kuru disease is a fatal and rare brain disorder. The disease came about during 1950s to the 1960s. The 4 people of New Guinea had participated in cannibalism. The cannibalism in question they engaged in was the consumption of deceased family members' brain tissues. This was highly infectious if the individual had Kuru. It was transmissible through eating or contact with open sores or wounds. Due to government dismay and concern, the disease has since declined and mostly disappeared. Kuru belongs to a disease class called transmissible spongiform encephalopathies, known as TSEs. This is caused of distorted protein molecules that bunch together and compile in the brain tissue. Prions, which are an infectious protein, are found contaminated in brain tissue. The people of New Guinea ate brains of the deceased as part of a funeral ritual. Government interference caused the practice to stop in 1960. Even after government involvement, there were still cases of it shortly after. Kuru is similar to Creutzfeldt-Jakob disease, which are both brain and nervous system changes. Symptoms for Kuru disease involve the following: arm and leg pain, coordination problems that may become serious, walking may become difficult, headaches, difficulty swallowing, tremors and muscle jerks, behavioral changes and moodiness, not necessarily bipolar disorder, dementia, inability to fully grasp objects, random outbursts of laughing or crying. These symptoms can be similar to Parkinson's disease or even a stroke. Stage 1 of Kuru disease usually starts with headaches and pain in your joints. Considering that these are common symptoms and can be mistaken for less severe illnesses, they can be missed as an indication that a more serious condition is ongoing. During the first stage, an individual with Kuru shows some loss of control in their body movements. They may have trouble balancing and sustaining their stance. During the second stage, the person loses their ability to walk. Tremors, impulsive jerks, and movements begin to take place. During the third stage, they are usually bedridden. They lose the ability to speak. They may also show behavior changes and even signs of dementia, causing them to seem carefree and unconcerned about their health. Malnutrition and starvation usually sets in during the third stage because of difficulty eating and swallowing. When diagnosed, death can be prominent after 1 year. Most people end up passing from pneumonia. There is a trigger warning for this next slide. There are 2 children who are malnourished. The cause is of Kuru disease or cannibalism. The picture on the right is a 4-child of New Guinea with advanced Kuru in the year 1957. She was sedentary for several months and was reaching the terminal stage of this disease. A few ways to diagnose Kuru disease is when someone is infected, the doctor is to perform a neurological exam. EEGs, which are electrodiagnostic tests, can be done to inspect electrical activity in the brain. MRIs can be done, but it might not show accurate results or even an indication of this disease. It can include questions and tests such as your medical history, neurological functions, blood tests of the thyroid, liver and kidney function tests, and folic acid levels. So treatments and end result. Unfortunately, there are no well-known or studied remedies to treat Kuru disease. When preserved in formaldehyde, prions will still remain infectious, thus not having any type of cure for Kuru. As an end result, people cannot stand on their own, eat, swallow, and will still require a lot of assistance. Since there is no cure for the disease, people can fall into a coma from 6 to 12 months after the first symptoms start to develop. The only way to prevent obtaining this disease is to limit your exposure to anything of the sort. The sources I used are as follows. I used 4 sources for my presentation. Thank you to everyone who watched my presentation. Have a good day.